Welcome, everyone. We're so glad you're here. We are offering this brief update on recent data trends. We are thrilled to have Christine Kukich from ACHA talking about the National College Health Assessment, and she'll be followed by Gary Langer, the president of Langer Research Associates, who will share poll data from Axios-Ipsos, including information that is just 10 days old. So we are pleased to have this very recent update to share with you.
Great, thank you, Heather. As Heather mentioned, my name is Christine. I'm the research analyst at ACHA, and I'm going to be talking about the NCHA, or National College Health Assessment. You can go to the next slide. So I just wanted to give you a quick introduction of what the NCHA is. It's a student health assessment that colleges and universities self-select to participate in to gather population data on their students. We collect it in the fall and the spring of every year. We have over 20 years of data now with almost 1,000 unique participating institutions and over 2 million student responses. And the data that I'm going to share with you today is from this past fall semester, which ran between August and December of 2021. It's preliminary data that includes all the schools that participated, but it's not our official reference group for the fall. So just keep that in mind. And we had 41 schools participate with an N of a little over 33,000. And back in fall 2020, we began adding COVID-19 questions to all of our NCHA surveys. And we've been adjusting those questions each semester as the pandemic changes, which has been challenging as it changes very quickly. And before we know it, we have a question that's out of date. So the questions from this past semester don't match up perfectly with the previous semester, but there's a few comparisons I still wanted to make between spring and fall. So we can jump into that on the next slide. So here are the two ways that we asked about vaccination status between the spring and the fall. In the spring, the vaccines were just being rolled out for students who took the survey early on in the semester. So our question was more focused on intention of getting vaccinated. Whereas in the fall, most respondents had the opportunity to get vaccinated and had either been vaccinated or decided they would not be getting vaccinated. And because of the differences in vaccine availability between the semesters, it's a little tricky to compare the fall and the spring. If you look at the numbers, like for the students that said they've already been vaccinated for COVID-19 in spring, we only ended up with 22%, but you have to keep in mind that a big chunk of our survey was in January and February for a lot of schools. So because of that, we like to kind of combine some of the numbers and get like a sort of idea of who probably would have gotten vaccinated or people that have like positive opinions towards the vaccine combined with those who got vaccinated. Go to the next slide. So that is what I did for this graph. If you look at the first cluster for the spring bar on the left in blue, I combined these question responses in blue. So that was very likely to be vaccinated, somewhat likely to be vaccinated, or I've already been vaccinated. And for the fall semester, we combined, I have received all the injections, I have started the vaccination process, or I will get vaccinated as soon as possible. And you can see that this group of students who either got the vaccine or intended to get the vaccine increased by almost 7 percentage points between the spring and fall semesters. And then on the flip side, the other side of the graph, I combined those in the spring that were somewhat or very unlikely to get the vaccine. And for the fall, I combined those who said they will only get vaccinated if required with those who will not get the vaccine. And as the number of students who were willing to get vaccinated increased, obviously the number who were not willing decreased. So that's about a similar change there. But we were definitely happy to see that this number did increase. Looks a bit different from the numbers we just saw for, I think it was the general population from 18 to 24. So we were happy to have a number this high. But one thing to note when looking at this is we don't have a way to measure whether the increase in this vaccine acceptance was due to a change in attitude or from the policy change that a lot of colleges and universities implemented by requiring vaccination for the fall semester. Next slide, please. Here's another spring and fall comparison of the same questions, but this one is looking only at students who were unlikely or not willing to get vaccinated, and it looks at them by race. So in this case, the orange bar for fall being lower than the blue bar for spring in each of those clusters indicates that the number of students not willing to get vaccinated decreased. So we like to see the orange bar lower than the blue. And the first cluster is all students, which hovered around 7%. And you can see the largest change in the Black African-American student group. That one went from 11.2% of students not wanting to get the vaccine down to only 6.1%. So it actually dropped a little bit below the average for all students when it started out above it. And the one group that had more students unwilling to get the vaccine between spring and fall was Native Hawaiian and Pacific Islander. However, you have to keep in mind that the N was very low for this one. We only had 44 students for the fall. So you kind of have to keep that in mind when looking at those numbers. But overall, there was an improvement for nearly all of the race groups. So we were happy to see that too. Go to the next slide, please. So in addition to changing the vaccine status question, we also added 2 new COVID questions for fall 21. One question was added to identify students with breakthrough cases. And this question asked, did you test positive for COVID-19 after you were fully vaccinated? And then we also specified the timeline of 2 weeks after a single dose or 2 weeks after the second dose of the 2-dose series. This question only appeared for students that selected that they were fully vaccinated and had COVID, which kind of made reporting on that one interesting because we sort of had to add back the other students who were fully vaccinated. But we didn't want to ask students a question that we knew the answer would be no to. So then the other question we added was to identify students who had or were currently experiencing long COVID. And this question asked, did you or are you experiencing symptoms that have continued more than 4 weeks after your initial COVID-19 diagnosis and were not experienced before the illness? We added some examples of fatigue, brain fog, heart racing, headaches, or worsening mood. And this question was only asked of students who reported having COVID. Go to the next slide, please. So looking at the results of the first question, this is kind of a little bit tricky and where some of the news articles sort of tricked people into thinking that the numbers weren't as great as they actually were for, or that the breakthrough cases were worse. So we used all vaccinated students as a denominator and found that 2.5% of fully vaccinated students reported having a breakthrough case in the fall semester. And that was 2.2% of the total sample. Now we know, like I said, things change quickly. We know it's going to be a lot different this semester. We do still have that question in there because we had to make the decision kind of back in December whether we were going to keep it. So it'll be interesting to see what that looks like for the spring, but we definitely know it's not going to stay that low. And then looking at the second question about long COVID, we had 29.3% of students who have had COVID-19 experience symptoms that continued more than 4 weeks after the initial illness. And of the total sample, this makes up 5.5%. We did think that was higher, it was higher than we expected. So then if you go to the next slide, I wanted to kind of dive deeper into that and see some of the effects of this or some relationships with it. And I took a look at long COVID and overall stress from the pandemic. So I put students into 3 different groups: those who experienced long COVID, those who had COVID but didn't get the extended symptoms, and those who did not get COVID. And it was interesting to see that the students who had the highest increase in stress were those with long COVID, while the ones who had COVID but didn't experience long COVID reported significant stress increases at 17 percentage points less than the long COVID group. So maybe these students aren't as stressed since they've already had it and had gotten over it compared to those who haven't had it at all and are maybe stressed about getting COVID. And this and the next slide are something that we hope to look more into once we have the reference group formed. And you can go to the next slide. All right, the final comparison I wanted to look at with long COVID was the Kessler-6 psychological distress scale. This is a 6-item scale that asks about feeling nervous, hopeless, restless, worthless, sad, and that everything is an effort in the last 30 days. And then the score categorizes the respondents' level of psychological distress. So the three categories are no or low psychological distress, moderate, and then serious psychological distress. And if we look at the last cluster of bars there on the right, the percentage of students with long COVID who are categorized under serious psychological distress is about almost double the number of students who had COVID but didn't experience long COVID. And then once again, we can see that those who haven't had COVID are somewhere in the middle, but closer to the non-long COVID students. And then looking at the low end or no distress levels, we see that the non-long COVID students are doing the best in that category as well. And I think I have one more slide. Yeah, so this one was kind of a late add, but I just wanted to show a little bit about students' perceptions towards policies and precautions. So we have a couple statements where we asked students their level of agreement, and these are the results. So we had 72.7% of students said that they strongly agree with their campus, that their campus has done enough to protect students from COVID-19. And then these next 2 points are kind of interesting. We had 90% of students say that they follow their campus policies related to COVID, but only 55.5% of students strongly or normally, I guess, agreed that students at their school are taking precautions to protect one another from COVID. So while most of them say that they're doing what they should be doing, they don't think that their peers are doing the same. And we definitely have a lot more to look at. We want to possibly write up a paper about this and do some more statistical analysis, but we are waiting until we have the actual reference group to dive in deeper. So I just wanted to give you guys a brief idea of what we've collected so far. And I see there are some questions in the chat. Very unlikely to get vaccinated denotes wiggle room. Is this a question you would consider for all? So the very unlikely to get vaccinated, that was an original question from the spring of 2021. And we've gotten rid of that one now. And it's basically saying you either have the vaccine, you intend to get it like as soon as possible, or you're not going to get it. So we did remove that because you're right, there is some wiggle room for what that really means. Any gender question? I'm not sure what that means. If you can specify.
I was thinking that the data you had looked at racial ethnicity, and I'm wondering if you're finding more interesting data between males and females, or just, the different genders, to see which of us is most likely or more likely. That, I mean,
yeah,
that's always interesting to me.
Yeah, that's actually what our main reference group reports have in them. It's broken out by gender. So that's one of the reasons why I didn't touch on that, because I haven't made the reference group report yet, but that report is completely broken down by gender. So you should be able to see the comparisons of you can look at all the questions compared by gender. But yeah, that's definitely a good question. How was the sample group selected? Did their individual school reach out to the students to complete the survey? So the way that we do it is the schools reach out to us, give us a sample. Some of them choose to invite all of the students at their school. Some of them will do a random sample. Some will do a non-random sample. For our reference group, we only use schools that do a census or a random sample. We don't do any like convenient samples or anything like that. So there's a variety of ways that they sample, and then some of the schools will reach out to the students ahead of time and say, hey, you're going to be getting an email from the American College Health Association to take this survey. And then we send the invite, 3 reminders to the students and a thank you message if they take the survey. So it kind of depends from school to school. Were there any findings by on or off campus cohorts? I did look at that I looked at that for the breakthrough cases, and I did see that there was definitely more students that had breakthrough cases that were living off campus than the ones in their parents' home or living on campus. It wasn't much of a difference. I didn't end up including it, but there was a small difference there. Thank you, Claudia, for posting the results for me. Any other questions? All right, well, if anything comes up, I'll also put my email in the chat and you can shoot me an email as well. And hopefully we'll have those fall reference group reports up soon. We're still waiting to hear back from a few schools to see if they're going to be in the reference group or not, depending on how they sampled.
Thank you so much, Christine. I'm going to stop sharing and turn it over to Gary to share his presentation.
Thanks very much. You guys got my screen?
Yes.
Thanks, Christine. I'm going to present some slides on some data analysis we really just completed last night with the data that's pretty current. Let me give you a run through what we got for you. I'm happy to take your comments and really look forward to any questions you may have about it. So I want to first thank Ipsos Public Affairs. We put forward a question to various survey research organizations doing ongoing polling on the pandemic back last spring, asking if they would put in their instruments a question for us. We designed to quickly identify the college community. And several of them did and agreed to do that for a short time, left it in the field for a couple of waves. Ipsos uniquely has kept our question in the field continuously since April in what are pretty much bi-weekly surveys that it's produced. We have data for 17 waves of Ipsos or Axios-Ipsos surveys with a net sample of, I think, 16,000 or 17,000 individuals in it, including more than 1,000 college students and 459 college employees. It really gets us to drill down. This is fielded in the Ipsos Knowledge Panel, which is a probability-based, randomly selected online panel of survey respondents, widely used and widely published platform. Our question: are you a student or employee at a college or university? And you can see the overall results there. About 10% of the population says so. The available data I'm going to look at here, the primary analysis I want to present, was intended to compare pre and during Omicron data. We have two waves from Axios-Ipsos in November that we're comparing with two waves completed first in December 10th to 13th, so just after the start of Omicron, and most recently completed just about a week and a half ago. This gives us pre and during Omicron comparison, including among college students. We have about 100, a little more than 100 in the first two waves and 100 in the second two waves. More than 1,800 non-affiliated adults, that is, adults not associated with college communities. But there are insufficient sample size for this analysis of the non-student college community members, that is, employees, staff, administrators, and the like. We do some additional analysis described below that does include those groups. The challenge there is that we're combining both pre and during Omicron data. Our first question is Omicron brought about any changes, the surge we've seen, the terrible surge in the last several weeks. I want to say that the data I'm going to be presenting are available. So Ipsos, Axios, and many other, in fact, most other survey providers in the US and internationally are contributing their materials, including their data sets, to the Sean COVID Survey Archive. This is a group assembled by the National Academies of Science to leverage the use of social science research in response to the pandemic. You can get at that URL there the very data sets that I'm going to be referring to, as well as data sets from probably by now more than 375 individual surveys out of more than 1,400 in the collection. A great group of questions in there too. So it's an open access resource for you. I hope you take a look. Key findings in our main analysis are we're seeing indications of pandemic fatigue among college students. No significant easing of vaccine rejection, indeed a non-significant numerical increase. A sharp rise in booster uptake among unaffiliated adults. It's not reflected among college students. Increased concern and risk perception, again, among unaffiliated adults, but not among college students. No increase in mask wearing or social distancing among college students, and decreased or slightly decreased trust in federal and state leadership. Give you some of these data points. First, you vaccinated against the coronavirus. That 2-point change among unaffiliated adults from November to December is not significant, and there's no change among college students. However, if you look at those who say they are unvaccinated and not at all likely to get vaccinated, we see a 4-point drop from 16% to 12% in this response among unaffiliated adults. We see no such change among college students. And indeed, there's a numerical increase in the number of college students saying they're not at all likely to get vaccinated, although given the sample sizes, it's not significant. Directionally, it's a little troubling, as you can imagine. If we look next at, the percent of people who report, vaccinated people report having received a booster shot, up dramatically among unaffiliated adults by 26 percentage points, from 33 to 59% November to December. You see a much smaller and indeed non-significant increase among college students of 10 points. And those are small samples, but again, we don't see that increased uptake of boosters among college students that we do see among other adults, the 90% of the population over there on the left. Number who are extremely or very concerned about the coronavirus outbreak, 10-point increase in concern among unaffiliated adults, no such change among college students pre and during Omicron. Number of people who see in-person gatherings of friends and family as a large risk, a 10-point significant increase among unaffiliated adults, no change among college students. We look about mitigation practices. The number of unaffiliated adults, not in the college community, who say they wear a mask outside the home all or some of the time, up 5 points. Among college students, a non-significant change, but directionally in the wrong direction, down 7 points. On the right, maintaining 6 feet of social distance at all times or sometimes, a marginally significant 3-point increase among unaffiliated adults, no change among college students. And trust are some of the steepest changes that we see in this population. Trust in Joe Biden to handle the pandemic is unchanged among unaffiliated adults pre-Omicron and during Omicron. It's down 18 points among college students. Trust in the federal government more broadly, no change among unaffiliateds, down a marginal 14 points among college students. Trust in the CDC, similar, non-significant, but directionally down 11 points among college students, while no change among unaffiliateds. Trust in state government, very much the same story. These additional results are a little bit more of a mixed bag, but I think still worth taking a look at. Seeing air travel or mass transit is a large risk to your health and well-being is up 11 points among unaffiliated adults. It's up 5 points, which is not significant among college students. Saying your mental health is worse is up 3 points among unaffiliated students. It's actually down 5 points, although again, not significant among college students. Having visited a retail store, not much going on, down among college unaffiliateds, no significant change among college students. One in which they're down in both groups is dining out. In short, I think that cumulatively, these results give us some concerning indications of pandemic fatigue among college students. I would say that there's some limitations here. Of course, the sample sizes of the college student population in this comparison are small, 100 in the pre-Omicron data and 120 in the most recent data. We did look at these two populations demographically, and they're pretty consistent, so we don't think there's any challenge there. I would suggest that a larger scale probability-based study of this population is warranted to get at some of these issues. Now, I'm going to look at some longer-term trends with broader data sets. The first is is a better result, more reassuring result. Now we're looking at data sets aggregated from spring, and then in summer, and then in fall, winter. That is from November to present. We've seen incremental changes in vaccine uptake among college students, as you see here in the left-hand bars. We saw a big increase among college employees from spring to summer. That's held, and we've seen increases among unaffiliated adults as well. And seeing a large risk to your health and well-being in attending in-person gatherings outside the household has been pretty flat among college students, as you see. There's a large increase among employees, it's pretty much held. And there was an increase from spring to summer in unaffiliated that's pretty much held. But that flat result among college students is not directionally what you might expect or want. In terms of subgroups, and we had to take a large swath of data to get these together, but uptake is similar among graduate students and undergrads, which is a change from the summer when we saw it higher among graduate students. So undergrads do seem to have caught up there. No difference between graduate students and undergrads and other associated attitudes. Uptake among faculty or administrators compared with college staff, identical. It was similar, but not quite identical previously. We took a look as well at student uptake or intention by race and ethnicity. The point I'd give you here is if you look at the July-January data, we had to get a large number of waves combined to be able to get adequate sample sizes. The vaccination rate, self-reported vaccination rate among Black students is significantly lower, 58%, than among white students, 73%, Hispanic students in between. If we add in, though, those who are not just vaccinated, but also likely to say they'll get vaccinated, that's the right-hand column here, July, January, you see it's pretty consistent across. If we look at it another way, look down at my comment there. Among white students with vaccination intent, 92% are indeed vaccinated. Hispanic students, 88%, but among Black students, 79%. So there's a shortfall between intention and action among Black students in getting vaccinated. That is one place I think to focus efforts. And other factors I'll mention briefly. We talked about these back in September when I last presented to you guys. Among all adults, 60% have an immediate family member who's been vaccinated. That helps establish a social norm of vaccination. Among those who have a family member who's been vaccinated, 8 in 10 are themselves vaccinated. Among those who don't have a family member vaccinated, 68% are vaccinated. It's similar among students, and it shows the impact of the social norm of vaccination. Additional key predictors, we've reported these previously. Trust in the vaccine safety and effectiveness, far and away the largest predictor of uptake. The presence of a moral norm, the sense that getting vaccinated is a community responsibility, not just a personal choice, and worry about infection. So in looking to increase vaccine uptake, probably also booster uptake, probably also mitigation measures. These are the key levers that encourage action. That's what I got. Appreciate it. I'll stop the share and take any questions you have. Thanks.
Thank you, Gary. No questions in the chat. Are there any questions from the group?
Gary, this is really interesting. I was wondering, you spoke about this disconnect between intention and action for the Black students, and I can imagine that there may be differences in terms of the level of barriers to getting vaccination in some communities as opposed to others. I'm wondering if you have any thoughts about that, or if anybody else has observations that kind of add to our interpretation of what that means.
Yeah, Jang, it's a little frustrating that we're working with found data here, so we don't get to ask all the questions we wish we could. But it certainly does suggest that there are barriers to uptake experienced by that community. It can be access to transportation, access to facilities, access to information. But there clearly is a breakdown there between the intention of these students to get vaccinated and through their self-reports, they're having carried it out. So I think that is an area that really cries out to be addressed and focused on.
Great. Thank you, everyone. Thank you to the advisory committee, and thank you to our 2 presenters.
Thanks.